Good morning, my viewers. Today, this morning, I wanted as we look at this tube, these ones we call them vacutainer, and this vacutainer, when you see a yellow top, a purple top vacutainer, that it means that vacutainer it contains a certain anticoagulant. If you can check well inside, we have some particles inside. Those ones we call anticoagulant. Anticoagulant, they are chemical substance that prevent the blood from clotting. There are some tests that you are supposed to do to carry out using whole blood, and that is a test like full hemogram, which is widely used anticoagulant in clinical hematology, and that work by chelating or binding calcium ions essential for blood clotting. And this one, it is preferable for the blood counts which include tests like CBC, which it means complete blood counts or the full hemogram. So the importance of this one is because of that anticoagulant. It preserves morphology of the cells, especially EDTA, that chemical substance that is inside this tube, that is EDTA. It preserves the morphology of red blood cells. So, and this test uh, carried out using this machine. This one is called full hemogram machine, and it has various blood parameters. It analyzes various blood parameters which include white blood cells count, red blood cells count, HB, and as well as platelets. So it has some 20 parameters, and also it has some red blood cells indices. Those red blood cells indices, they include MCV, MCH, and also MCHC. Those ones are red blood cells indices. They are used to classify the anemia that person might be having. That is, if somebody is having low HB, that it means that person is anemic. So MCV, MCHC, MCHC, those ones, they will help you to classify if somebody is having the most common type of anemia, which is iron deficiency. So the doctor will be able to analyze those red blood cells indices and will tell you maybe you are having iron deficiency or those other kind of anemia that you are suffering from. So it is a very important test, and it is normally done alongside with a full hemogram, with ESR, erythrocyte sedimentation rate. Have a good day.